Enjoy. The responsibility of influencers in the healthcare sector. Good morning. Good morning, Carlos, Fernando, Mellanie, Natalia. First, I want to greet our audience. Thanks for your time. I'd like to thank the FIS initiative for putting together such a huge event and such a great event. And also thank you, our panelists, for this extremely different discussion. It's not a technical subject, but it is very relevant about the responsibility of influencers. And in this panel, what's nice about it is that each of you comes from a specific and different background, from different communication channels. And our intention is to have a conversation with our guests. So I'll start with the ladies, and I'll start with you, Natalia. A very straightforward question. What was the difference between communication in the healthcare industry before the pandemic and during the pandemic, since it's not yet over? Good morning, Andre, and good morning to our audience. I want to thank the FIS initiative for the invitation. So your question is about the communication in the pre and post-pandemic scenario. I'll quickly introduce myself. I've always covered health-related matters. A journalist specializing in health. And before COVID, I covered other pandemics, epidemics, the Zika virus and others. And we'll have a lot of time to discuss this, but I think the most important thing that changed was the way the internet gives voice to everyone, especially during the pandemic, when people had to stay locked in due to the situation that we were going through, and they were hungry for information and as quickly as possible. We ended up using social media and influencers as a way to consume content. That did not happen to the extent that we're now seeing. In the past, the social networks were a certain source of information. We have Drauzio Varela as a healthcare influencer, but he's a very specific voice. We did have some physicians that talked about health, and the fitness bloggers that talked about healthy eating habits, patients talking about their stories, cancer patients and whatnot. So there were these very specific things, but with the pandemic, that changed a lot. Now we have a huge diversity. It is a more specialized type of communication. We have scientific communicators that do make a difference in terms of spreading and sharing data and information. And we had to educate the audience in terms of what content they can and should consume, who's reliable. When you disseminate information from several different sources, who are you going to trust? So I think the biggest difference is in the way the message is amplified. Thank you. And Dr. Fernando, you're a commentator in a very formal communication and media. what did you feel? Was there a bigger pressure on your opinions? People all of a sudden found out what clinical tests were and other terms as well. So what's different? You're on mute. We can't hear you. So as we get his audio fixed, I'll ask you, Mellanie, you have an important participation in that you're in a network that works directly with COVID-related scientific information. So how did you start? How did you feel? Or when did you feel that this type of communication has a good penetration? What was it like for you? Well, I started to create the network back in February 2020 with some friends. Initially, our intention was to create a forum for healthcare professionals to discuss scientific data from other countries and articles to be better prepared about what to do in face of the COVID pandemic. That was our initial intention. But then we saw the need for a closer contact with the general public, disseminating information in a more accessible and playful manner, making it more interesting so that people in general could use that information to make their decisions. And it was based on that our network structured itself and started making connections with other pre-existing groups so that we could keep in touch about pandemic-related data and exchange those data with the population. And that's what we ended up doing, both in terms of the network and in terms of my personal profile. Thank you. Dr. Luis Fernando, I think you're back, right? We can hear you. Good morning, Andrea. Good morning, everyone. It's a pleasure to be here. And it's a pleasure to meet you in person, as it were, because we only see our tweets. Well, I'm a physician for 20 years. I have a bulletin on CBN every day. And well, during the pandemic, we had to do two things. First, we had to inform the population, and we had to find a way to fight misinformation. And I think that was the biggest challenge. With Betty Zanji and Carlos and other scientists who have a fundamental role in the fight against misinformation. But this is still a huge struggle. The entire programming grid of the radio CBN changed at the time, and we doubled down on the time that we spent giving health-related information. So there were lots of changes. But I think that what we should do now, Danielle, is to think about how to leverage everything that we went through and this willingness to learn by the population, even in the face of misinformation, how we can leverage all that and continue to deliver knowledge. Of course, we became monothematic. We only talked about the pandemic and COVID and that kind of stuff, but we have to expand our possibilities. The biggest problem in Brazil and maybe in the world is what we call healthcare mindset, which is something we don't have. The knowledge level of the population about health is really low. We're living in our bubbles, and there are many people who are interested in health within our bubbles, but we have to expand that. That's very interesting. I think that one of my first lives during the pandemic was with Natalia. I don't know if I'm wrong, right? Yes, the first of many lives we had during the pandemic, right? Yes, that's right. You mentioned something really interesting, Doctor, about misinformation. I participated in a discussion at UNESCO, and they were talking on the one hand about this huge amount of information, uh, but on the other hand, health is shared knowledge. And at UNESCO, people are saying that misinformation is as bad as good information with as bad information with good intentions behind it. And the population is not educated to analyze that and probably never will be. So we have the role of training the trainers and educating the sources of information, as it were. So the work that you do, you disseminate a lot of content very broadly, and you have a huge responsibility on your shoulders in terms of making it work. Hi, good morning. It's a pleasure to be with you. The web page, when we created it, we had no intention of disseminating scientific information to the population. We were joining the biomedicine course, and we wanted to establish a channel of communication with other students. At the University of Pernambuco, we have this adopter mindset. As soon as you join a university, a more experienced student will start guiding you, as it were, and giving you tips. And that's what we wanted to do, to create a means of communicating with this type of person. So we started discussing scientific articles and Congress, but we started adopting a simpler terminology. And with that, we started attracting the general population. And that was something we didn't expect. So we started thinking, well, let's talk about some fun facts like caffeine because it's interesting, or a certain molecule, or why do kittens purr, or let's talk about healthcare in general, or the importance of vaccines, where the vaccines came from. So after that, we started talking about science in general, not only healthcare, but of course, healthcare is the most important subject we talk about because it's the center, the main focus of our studies, our course. Sure. And there's another thing. I felt that people started approaching me to ask me about things and to tell me that, well, now I know what you do. So public health policies, there was something that was just written somewhere and kept in a jar, and now it's not anymore. So Natalia, my parents are physicians, and well, on several different occasions, I felt fed up of talking about COVID, but we have to go on talking about it. So how do you see, I know that COVID is 90% of what you discuss, but how do you see the possibility of attracting people to discuss other subjects in addition to COVID? Well, that's a great question. I think we cannot miss that opportunity. Now, everybody is looking at the healthcare industry, and people got curious about it, and they're interested, and we cannot miss the opportunity of trying to engage people in other subjects. Of course, COVID is still an essential subject because the pandemic is not over. The vaccination is still ongoing. We have to be careful. We all know that. So I don't think it's something that we're going to forget anytime soon during the next months or years. It's still a relevant subject, and there are still many questions around it. And it's not like the subject is over. The questions are now different because Christmas and New Year are just around the corner. So should I take a second shot or a third one, or get tested? So we have to work on that. But how can we attract people towards other subjects. I think we have to adopt the same methodology as we did with COVID. If you want to talk about public health, no one in the past was aware of the importance of the Brazilian public healthcare system. But now, because of the vaccine, people are now posting hashtags. Long live the Brazilian public healthcare system on social media. So I think we should do a campaign about the importance of vaccinating children, adolescents, the importance of providing funding to other diseases. What happened to cancer patients that did not do their screening tests, such as mammograms and so forth. So I think that we could expand this subject by bringing in necessary information to the table. And there are several different groups that we can break the population down into. There's the general public that wants to know what to do about the vaccine and if they can go to parties or not. There's a more segmented audience that really likes the healthcare subject, and this group is having lots of discussions about the transformation of the sector. There are many panels in this event talking about what's going to happen moving forward with the healthcare, sustainability, and so forth. So all these subjects are joined together, and I think that we can discuss them in a closer manner. I think we should leverage this opportunity and talk to people in a way that they can understand us. Well, that's really nice. I'm in the US. I live in New York, and I have many friends from the UK. And back in the beginning, I would check my Instagram feed, and there were lots of Save the NHS hashtags. And I was wondering, well, will that ever happen with the Brazilian public healthcare system? I think maybe one of the only positive legacies that we have from this pandemic was, like you said, people rediscovered, even though the Brazilian public healthcare system has many challenges, and in the US we do not have a public healthcare system, and it's more or less like that. The government itself was funding vaccines free of charge for everyone, and kind of mimicking the Brazilian healthcare system. And Dr. Luis Fernando, picking up on that, maybe on your end, there's an even more important role, because being inside CBN radio, several other commentators will talk about health, because, of course, it's at the top of our list. But other commentators, which are not from the healthcare industry, well, what's it like for them? I mean, your role is also one of educating them and giving them guidance. So what's your routine like to make sure that information that's passed on to your colleagues is accurate? Well, that's interesting, because even though I've been at CBN Radio for 20 years, I think that since, when we started the show, it was the cassette tape days. I'm sure that Carlos has never even heard about that. So the show started being recorded in a cassette tape, and then we started adopting new technologies. And I also went through the same experience on TV. When I went to Globo TV, I think I was the first physician inside a TV newsroom. And Drauzio, he's in a newscast, but he only shoots certain specific parts of the show. And I used to tell that an analyst has a lot of knowledge, a sea of knowledge that's only 10 inches deep. And of course, we have to face some prejudices and biases that the population has, and journalists that are not specialized, do not specialize in healthcare, they'll have the same prejudices as anybody else. And we apologize, he's breaking up. So we have to use WhatsApp and text messages and tell people off and monitor people. The translation booth apologizes. The speaker is breaking up.
That's very nice. People ask me, why don't you give your opinion about this vaccine or that vaccine? That's not right. That's not the right thing to do. Experts usually are the last people to speak. Anyway, but there's something that is very nice about it. What Carlos and Mellanie said. There will be a new generation of young people that will be able to communicate, to talk about health-related issues. And they had to learn on the spot. What's your take on this responsibility? There's no course on responsibility. It's very fragmented. Is that some sort of media training? How do you look for that kind of information? How do you approach that communication? Because you know, you end up influencing a lot of people. Yes, there are courses on scientific communication. There are many prestigious institutions. The AMERAC task force, actually there are several courses available. even remote ones, to learn about how to communicate scientific information, how to be responsible, evidence-based manuals, just like Jose Alencar published at Sanar recently. In other words, there's a lot of content if you want to learn more about evidence-based science that is applied to health, but how to apply this type of content responsibly, providing information, not oversimplifying it. This is something that has to be done. It's being encouraged as we speak. Our network aims at being this reference so that people can resort to that kind of information to have curated scientific information. When I started that communication course back in 2015, and especially during the pandemic, I didn't have the chance to take that course. So it was trial and error. More successes than failures, because any minor failure could have had very detrimental effects. So I was extra careful so that there wouldn't be any negative repercussions, especially during the critical times. We ended up filling that gap of information over social media. That was a very critical point in time, and information had to be double-checked. Yes, thank you for bringing that up. These programs were very restricted. I was once asked about the Cochrane, so almost nobody asked me about it. But again, it's becoming more and more accessible to whomever is looking for that kind of information, of course. Back to you now, Carlos. Let's take a step back. Before they look for that training, quote unquote, in health education, they must first be aware that they need it. You talk to young people they're just starting out. How do you communicate that? How do you instill that notion that they have to be responsible? Well, the first contact was through extension programs. We go away from the university campus to reach out. People often ask me how much the tuition is, and I'll tell them, oh, this is a public, it's free of charge. So many people know where the campus is, but they have no idea what goes on in here. So we came up with analogies. Okay, you like serious? Okay, let's come up with a post making that analogy between friends and parts of the body, LAC and COVID, ER and transplants. I mean, we try to come up with content that is not scientifically related per se, and trying to connect to something they already know. Let's come up with an Instagram post. So let's try to make that as visual as possible. It's social media. People want to have fun and relax. No one is willing to read that long text. So we came up with something that is visual, which is pleasant, trying to come up with an analogy and, of course, convey the essence of the message. Health is interesting overall when we compare to, of course, the pandemic brought that to the surface at a much larger scale, but has always been an attractive subject. But just like you're coming up with this new format, Natalia, you have a communications channel way beyond communication per se. Anyway, there's a boom out there. So many people wanting to analyze data. I say, I came up with a database and from the health public system. I say, oh, that's fine. We've been doing this since 2011. So how do you see yourself next year? What are we going to be talking about? What will our role be in the post-pandemic world? Well, that requires a lot of reflection. Let me think about that. Before I do that, let me make 3 comments. Dr. Luis Fernando says that Natalia is sometimes upset. No, I don't get upset. I think that we have to talk about the importance of how training is important when you talk about health. Of course, there are journalists that are not health specialists. The reality of a newsroom is different from what one would expect, different from the ideal world. So it's difficult to specialize in something when you have to address so many different topics. So you have to be a good communicator. You have to think about scientific communication. And then Andrea mentioned it. We have a lot of information available, more structured courses. That was not as accessible pre-pandemic. There's so many online courses available, renowned people coming up with new content, and we didn't have that before. Our training was taking specific mini courses at one hospital or at a clinic. So I'm very pleased to find out that this is here to stay. And now let me address your question about the post-pandemic world. In that sense, health-related communication will be stronger. I see more colleagues studying and getting ready. I want to see more people bringing in good quality information to being able to analyze databases and being humble enough to know what their limitations are. You won't be able to address these things in just 1 hour. Okay, let's try to interview those that have been doing this for a decade or so. So we're coming up with that awareness amongst communicators. What will Natalia be, or what will I do after the pandemic? I have this content hub. That's my goal, to have a channel for social media, podcast, text. That's my mission. That's my goal. I truly believe that I have to convey message to people in a way that is simple. They can actually understand the message that is being conveyed, not only for the general public, but within the industry. Journalists that have to talk about different subjects, and they may not be as familiar with those things as one would expect. And you can only change your reality once you understand it. You can only engage people when they truly understand that you have to get vaccinated. There's no point in just saying, go get a vaccine. So in the future, that message will be more embedded, and we can take that to other types of content. I believe that the audience will be more engaged than it is today. I don't know whether I answered your question. No, I loved your answer. Perfect. There's something else, Dr. Luis Fernando, back to you. I've been working on evidence-based medicine and any other fancy jargon. I've been doing this for over 10 years. And one of the most important things is to curate data. We have a Coursera generation that have learned to come up with a model without the necessary context, not knowing whether the data was correct or not, whether there's any selection bias, or information collection bias. And also in the world of communications. We have to take into account as to how to curate that kind of information too. Oftentimes you hear an expert's opinion from Harvard, and you never know whether that's true or not. What's your opinion as to how can we trust information? What kind of mechanism can we use to help the population to tell what's true and what's not? I think we'll have to learn to respect information. I've been working with hospitals, trying to look for information in different databases. I'm sorry, but it's breaking up. We cannot interpret.
I am a cautious optimistic, as I used to say. Uh, Sometimes it's like, the newspaper said that the pandemic is over, but it's really something gradual, and that you go through a very strong spike, and then you have to gradually come down from there. And Mellanie, we as researchers, we live in our own ecosystems, as it were. And as Dr. Luis Fernando said, each bubble has its own congress. And in a certain way, the pandemic, I think that the COVID network that you lead is all about that, about bringing together people from different backgrounds. Obviously, that used to happen, but it was not super scalable. So, what's it like for you? Or what are the difficulties that you're facing in terms of bringing people from the academia to communicate to people that are not from the academia? Well, it's really nice to see that people are really interested in breaking these barriers that we often create. We stay away from the academia and the environment of scholars, because we usually think that it's more comfortable to talk among ourselves, because we use the same terminology, the same scientific language. But what I think is that this sense of social responsibility has hit us at the same time after the pandemic, and many people started having this idea of moving forward with this initiative. And this is where our initiative came from. We wanted it to be perpetuated after the pandemic. And that's not an idea that came just from myself or any other coordinators. This is actually by request of almost 50 or 60 members that the network currently has, and that they wanted to help people who want to tread an easier path than we did in the beginning. So I think it's about that. I think it's about optimizing the path forward and paving the path for other people to tread. And the fact that we have people from different industries, that's what it's about. We want to communicate among ourselves and establish this conversation in a fully virtual environment, and transform that into a communication that will reach out to other audiences outside of the network. So, of course, each of us has its own way of trying to understand how to best communicate the subject that they specialize in. But I think that we also find subjects in common, because we never ever write our articles only from the perspective of physicists or biologists, or no, you have somebody from risk management who works for a business, a private company, that is talking about social distancing and vaccines with a biomedic. So there's this crisscrossing across several sectors that initially may apparently not converse, but I think that it makes less and less sense now to do science from one single perspective only. What really makes sense now is to bring this knowledge that may be initially highly focused on that specific sector, and we should disseminate it across a different sector. And I think that in spite of the problems with peer reviews and other challenges, it was a tool that let several different people from different backgrounds discuss those subjects before the article was published. And what I saw was that lots of aspects from that discussion were incorporated, making the article much better. So I think this is a very nice initiative, and hopefully not only scientific communication will continue to be broad and encompassing in that regard, but I also, hopefully, that will be brought into the academia because, of course, this benefits everybody. I also had this feeling that the academia is learning now to better explore other tools apart from the final article. There was this occasion when a friend of mine said, well, I read one of your articles and I was able to understand it and was like, wow, that's good. I'm a chemical engineer, but I work in the health sector. But well, anyway, that's just a fun fact. We're moving towards the end of our panel. So I'd like to ask you to please say one or two words about what you think your role is in this regard. So I'd like to start with you, Carlos. How do you see yourself and your role moving forward? As Dr. Lewis and Mellanie said, we from the younger generation were really upset by the fact that society lost contact with science. Everything was well, and then came the pandemic. So the scientists started telling everyone to stay home and do social distancing and wear masks. But that was a person that didn't have contact with the society before the pandemic, and now that's a person that wants to set rules and tell you how to behave. People didn't accept that, so we think it's really positive that this contact has now been established, and we wish to maintain it. There's this OASE page that we really like because it involves people that want to talk to scientists, but they have no idea how to do that. They don't know how a public university works or how research works, and they're really interested. But we see that the university does not open its doors, and we, from the younger generation, we want to create this connection. Great, thank you. Natalia, what are your final comments? Well, I want to thank you for the excellent discussion. This is something that we need to have more of, sit together and discuss. Like everybody said, Mellanie, Carlos, Luis, and you, Andre, each one of us has a very important role in health communications and in the difference that it makes for society. And that's why this type of event is so important. Well, I hope that communication continues to be strengthened, that this is not only a fashion that people are all of a sudden interested in, and then this interest dies as soon as it appeared. And I think that, well, more than that, and I think that that's clear for the population in general and for people who consume this content. The content that we write is difficult. It's not that simple to simply pass on information to people, because like Mellanie said during her speech, she preferred to overdo things in the beginning. That's what we all do. We are excessively careful. We do a lot of research. We know about the importance of preprints and other stages of a publication, but it's not only about just saying something off the top of your head. So hopefully people will understand how complex information is. And I think that we have a long way ahead of us, being able to explain and being credible on camera, on YouTube, anywhere. That does not mean that you're passing on accurate information. And I think that that's something that is still present in everyone's subconscious. Even though we focused heavily on the positive aspects during our conversation, I think that we still have to try to combat the super dangerous influencers. They might be micro or huge influencers, but the thing is, they are good at speaking and they're deceitful. So hopefully, what I expect is that we'll do our jobs helping fight misinformation that is so widely spread nowadays. Thank you very much. Thank you. That was a great comment. And Mellanie, for your last words, and Dr. Luis Fernando. Well, first and foremost, I want to thank you for the opportunity to be here with such respectful and inspiring people in everything they do. And I also want to invite our audience, and I would like to be invited to do this back in the past, invite anybody to disseminate scientific information. You don't have to be a scientist to do that. And it's important to highlight that because many people end up feeling prevented from doing something that they would genuinely like to do and would do well because they are not from that industry. And I saw several people from outside the academia that are extremely good at disseminating scientific facts because they're good at studying, doing research, and being as accurate as possible. And with that, that person has created a connection with science, and that connection will probably never be broken. When you become closer to science, you also bring society closer to science as a whole. If we can all do that, we'll be talking about a solid team that moving forward will be talking more and more about science and looking for scientific facts before making any decisions, because science is truly an ally to society. And the anti-vax movements and others will start losing strength. So my invitation to all of you is, if you feel like disseminating scientific information, please do so by all means. We need more voices and people willing to do that. And if that's an entry door into the scientific world, and after that, if you feel like becoming a scientist, well, that's even better. It will be a pleasure to have you as a colleague and an activist. Thank you. That's great, Mellanie. Dr. Luis Fernando? Well, thank you, everyone. It was truly a pleasure to meet you, albeit virtually. Like Mellanie said, we only see each other on Twitter. I just met Carlos. I'll start following them. And I will also have to add my 2 cents to this story, which is all bells and whistles. But we have to say that the power of the negative side is really strong, and they have a lot of money. And at the end of the day, we must understand that there's probably one key aspect missing from all that. Science needs to understand that it will not get accepted just because it's right. We have to learn that by demonstration, but we have to organize ourselves to really work towards that. Because these criminals, and that's what they are, they're really organized and they make a lot of money. And they use that money to kill people like they did during the pandemic. And my words may sound harsh, but that's true. And we have to bring more people into the conversation, talk more about science and health, but we have to be organized and fight these movements, these criminal initiatives. We cannot think that simply because we're doing good that will be winners. We'll only win if we are organized in what we do. We will not win against the anti-vaxxer movement or denialism just because we're saying accurate things. We have to play the game, not from a negative perspective, but we have to play the game. We have to be able to work with the algorithms of each platform, each social media. We have to be able to work with the all of the mechanisms, because otherwise we'll be swimming against the tide. And of course, the tide is huge, and that's something that we only feel when things happen. But the anti-vax movement has been there for how long? I can't even tell. One of the most important senators in the US lives off of votes for the anti-vax movement. And there's this guy, Dr. Mercolo, with this horrible name, and he actually makes money by being a con. And we can't relax. We have to work against that. We have to attract youths and disseminate scientific facts. Of course, everything that we mentioned here is nice and is good, but we have to use that to fight these people. Otherwise, we will continue to fight and not reach anywhere. I'm sorry. I've been the bearer of bad news, but it's actually not bad news. I just want to draw your attention to that, to the fact that we have to be able to organize ourselves and deal with bots and et cetera and whatnot. The algorithms, we have to play the game. Well, that was a really nice speech, Doctor. And I think they really summarize our roles and responsibilities. I think that in addition to our responsibilities, which is the basic, knowing what your responsibility, what your role is, I think two things have to be made very clear, especially if you're beginning on this path, which is a relevance and consistency. Doing something right one day is easy, and doing something right every day is not as easy. So picking up on what you said, Doctor, it's all about consistency. It's about speaking the truth every day, day after day. And I think that is the way forward. And relevance, well, it's really important to say that the academia will give us that. It's not enough to do an analysis and publish the results of your analysis. You have to ask the right questions. You have to answer the right questions. And during the pandemic, we're doing that very well. We're answering the right questions, but we should continue doing that, continue to answer the right questions and not simply analyze data just for the sake of doing so. So this is the end of our conversation. It was actually much better than I expected. Thank you for your time. I want to thank our audience, our viewers, and I'd like to remind you that our panelists, they all have a very, they're on social media. Please follow them. Follow our podcast. I'm with Manu, and we have one episode every 15 days. And thank you. See you soon.